everyone, this is Dr. Lorna and welcome to the segment of my channel, Knowledge is Power. Today, I will talk about dengue. In here, I will tackle the important things that you must have to know.
To start with, what is dengue fever? Dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas in the world, including Philippines. Do you know that dengue fever is spread through the bite of a female mosquito, Aedes aegypti? The mosquito becomes infected when it takes the blood of a person infected with the virus. Aedes aegypti bites primarily during the day. This species is most active for approximately 2 hours after sunrise and several hours before sunset, but it can bite at night in well-lit areas. This mosquito can bite people without being noticed because it approaches from behind and bites on the ankles and elbows. According to the World Health Organization, the global incidence of dengue has grown dramatically with about half of the world's population now at risk. Although an estimate 100 to 400 million infections occur each year, over 80% are generally mild and asymptomatic. Now, how will you know that this is dengue fever? While majority of the dengue cases are asymptomatic or show mild symptoms, it can manifest as a severe flu-like illness that affects infants, young children, and adults, but seldom causes death. Symptoms usually last for 2 to 7 days after an incubation period of 4 to 10 days after the bite from the infected mosquito. Dengue should be suspected when a high fever, such as 40 degrees Celsius, is accompanied by two or more of the following symptoms during the febrile phase, which is within 2 to 7 days. Severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, swollen glands, rashes. A patient enters what is called the critical phase normally about 3 to 7 days after illness onset. During the 24 to 48 hours of critical phase, a small portion of patients may manifest sudden deterioration of symptoms. It is at this time when the fever is dropping below 38 degrees Celsius. Warning signs associated with severe dengue can now manifest. Severe dengue is a potential fatal complication due to plasma leaking, fluid accumulation, respiratory distress, severe bleeding, or organ impairment. Warning signs that we must have to watch out are severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, fatigue, restlessness, liver enlargement, blood in vomit or stool. After the critical phase, we have the recovery phase or also known as the convalescent phase. Patients who survive the 24 to 48-hour critical period will begin to reabsorb the fluids that leaked from the intravenous space. So, the following may be observed during this phase. Patient will report sense of improved well-being, return of appetite, increased urine output, the vital signs will become stable, thus the CBC picture, the hematocrit, the platelet, the WBC will return into normal and there will be an appearance of the characteristic rash of dengue, which is known as the Ehrman's rash. Several methods can be used for diagnosis of dengue virus infection, depending on the time of patient presentation. The application of different diagnostic methods may be more or less appropriate. Let us start with the gold standard, which is the virus isolation method. The virus may be isolated from the blood during the first few days of infection. We have the RT-PCR method, which are available and are considered as what I have said the gold standard. However, they require specialized equipment and training for staff to perform this test. The virus may be detected by testing for the virus-produced protein called NS1. There are commercially produced rapid diagnostic tests available for this, and it takes only 20 minutes to determine the result, and the test does not require specialized laboratory techniques or equipment. Another is ELISA, or the enzyme-linked immunosorbent assay. This confirms the presence of a recent or past infection with the detection of the anti-dengue antibodies. IgM antibodies are detectable 1 week after infection and remain detectable for about 3 months. The presence of IgM is indicative of a recent dengue virus infection. IgG antibodies take longer to develop and remain in the body for years. The presence of IgG is indicative of a past infection. But of course, the basic test is CBC, where leukopenia or decrease in WBC, thrombocytopenia or decrease in platelet, and increase in hematocrit level will be observed. There is no specific medicine to treat dengue. If you think you have the infection, rest as much as possible, take paracetamol to control fever and relieve pain. Do not take aspirin or ibuprofen. Drink plenty of fluid to stay hydrated. If it is possible, you can add electrolytes on it. And then, of course, see your healthcare provider for proper management and treatment. For the prevention and control, DOH implemented strategies for us to follow. The 4S strategy: search and destroy, seek early consultation, self-protection measures, say yes to fogging only during outbreak. The Department of Health and its partner departments launched its latest campaign against dengue, known as Action Barangay Contra Dengue, in an effort to stir up community action that will be sustainable, target-driven, and that can be adapted by LGUs with perennial threats of a dengue epidemic. Gawing dengue-free ang inyong barangay. Magtulungan para hanapin at linisin ang maaaring pagpugaran ng mga lamok. And that starts from your own home. Secure self-protection. Magsuot ng pantalon at damit na may mahabang manggas. And use mosquito repellent.
I hope that you learned something and you are willing to share what you have learned today because knowledge is power.
I would like to say thank you very much for your support for having 2,000 subscribers as of June 2022. Thank you very much and keep on watching.